Hello friends, for those of you who do not know me, I am Dr. Deep Goyal. I am the Chief of Surgical Gastroenterology Oncology at BLK Max Hospital, New Delhi. Today I am joined by my two young colleagues, Dr. Ravindra Vats, who is a Senior Director in the department, and Dr. Diksha, who is a Senior Consultant. And today we are going to talk about pancreatic cancer. Dr. Diksha, tell us how common is pancreatic cancer?
If we look at all GI cancers, the incidence across India has been increasing, and we see a higher incidence in younger population. So traditionally, though we say that it's a disease of the elderly, 60s, 70s, patients who are obese, diabetes, but now we are even seeing them in younger patients.
And what are the common symptoms by which patient presents, and when should it ring a bell in the mind of patient
Yes.
and doctor?
That's right, sir. It's a very important thing to understand for the common man. What happens is in most GI cancers and similarly in pancreatic cancer, the disease presents itself late. So usually the patient will feel that they are not feeling hungry. There will be loss of weight. The weight loss is in the absence of an active effort to lose weight. There might be some vague abdominal pain or pain in the upper part of the tummy which goes to the back. In some patients, especially if the disease is in the head of the pancreas, the patients may have jaundice or vomiting. So all of these things raise a bell. They should raise a bell in the patient's mind. Any symptom which is persistent, which goes on for longer duration, is a cause of worry and needs to be evaluated.
So what you're saying, anybody who has a sort of loss of appetite, losing weight, has jaundice or vague pain abdomen which is not settling with medication should raise an alarm and you should see a doctor.
Yes, they should see a doctor.
Right. Dr. Vats, what do you think that where should the patient go when they have these symptoms? Which specialist they should see?
Actually, initially they should go to a gastroenterologist and a gastro surgeon, and they should explain the symptom. The doctor will advise them some tests, mainly the liver function test and some radiological test, maybe initial an ultrasound and then a CT scan or MRI. And he will also, he or she might also undergo some endoscopic procedures to definitely know what exactly the cause is and to define what the disease is, and then accordingly he will investigate and accordingly he will decide the further course of treatment.
So that is an important message from Dr. Diksha and Dr. Vats, that do not ignore your symptoms, see a specialist and get investigated.